Would you like to look and feel 10 years younger? Do you even think this is possible? If healthy aging or anti-aging is something you are curious about, then stick around because Dr. Robyn Benson is going to let us in on some of the secrets behind regenerative medicine, including how you can regenerate a new, healthy body naturally. Welcome to C60 Health Connections, where we meet with leading experts who can help you elevate performance in all aspects of your life. My friend, Dr. Robyn Benson, is with us today. She is a regenerative medicine specialist, author and speaker, and is the founder of Santa Fe Soul Center for Regenerative Medicine and Destination Regenerate in Santa Fe, New Mexico. For 30 years, Dr. Benson has applied her knowledge of PRP, acupuncture, herbs, IV therapies, ozone, and leading-edge energy medicine to help patients get out of pain, restore sexual function, and look and feel 10 years younger naturally. She is also the host of the popular podcast, Younger, The Art and Science of Youthful Aging. My name is Jessica McNaughton, and I am the CEO at shopc60.com and C60 Purple Power. I'm a business executive with years of experience in corporate America, and for more than 20 years, I've been exploring various modalities in health, wellness, and spirituality. Now, before we get started, any statements, products, or remedies discussed today have not been evaluated by the Food and Drug Administration. Any products or topics discussed today are not intended to diagnose, treat, cure, prevent, or mitigate any disease. Robyn, I'm so excited to see you. Thank you so much for joining us today.
It's such a pleasure to be here with you. And I just want to say we're just so thrilled with C60. We've been using that with a lot of our patients. And I personally have used it through yet another dental journey. And just something that I like to just put in my coffee every day, or just be aware of the powerhouse, the power molecule that C60 is. So it was wonderful to interview you and Ken, right?
Mm-hmm.
And that podcast is available for anybody who's listening. Just go to robynbenson.com podcasts.
Cool. Well, thank you so much. And I'm so glad to see you. Always appreciate your great feedback. And I love those angel wings. I love your backdrop. It's so fitting for you. You are an earth angel for sure.
As are you.
Thank you. Today's conversation, I'm so excited to have because you are on the leading edge of all things anti-aging, healthy aging. You're a biohacking queen, and you help so many women and men look and feel younger naturally. And so I kind of want to start at the beginning because a lot of what you do is, it's not mainstream. It's new news to a lot of people. And I would really love the opportunity just to kind of ask you some basic questions about, I just want to start with, what does it mean to be a regenerative medicine expert?
Woo! Well, regenerative medicine is the fastest area right now of any type of medicine. And just so all the listeners understand what exactly that is, because a lot of people hear about stem cell treatments, they hear about exosomes, but they're so confused when it comes to their own body, and for good reason, because it is relatively new and it's just can be exploited in certain ways. But I'm just going to give you kind of what I consider the definition.
Let's do that.
It's the reverse of aging and degenerative disease. So my mission, honestly, Jess, is to help as many people turn degeneration into regeneration. And it's so possible, whether you're in your 30s, your 80s, your 60s. It's the science of boosting healing naturally in damaged tissues and underfunctioning endocrine immune systems. It uses nutrition therapy, stem cells, and oxidative medicine, which I'll go into, like vitamin C therapies, NAD, and a lot of people know about NADs, the power of them. It also includes restoring healthy joints, hair growth, skin rejuvenation, and sexual function with your own platelet-rich plasma, or what we call PRP, the golden elixir. But You know what? Do we have time? This is going to be a video, right? Will people be able to see this?
Yeah.
I would just like to show people what a regenerative medicine center looks like.
Really? We can do that? Will you take us on a little tour?
Yeah. Some people call this like the amusement park of health restoration. It really is. I mean, in terms of all some of the top health technologies out there, I'm really big on the healthcare revolution and what we can have in our own homes, like pulse electromagnetic field technology is really important. If we can get infrared lamps, there's so many things that you can have 24/7 that I think are really important. But then you've got some like uber high-end stuff that we have here that our patients can come to and use. So here is.
Okay, I think you've got to turn off.
Oh, I've got to turn my little jazzy snazzy thing off. Let me do that really quickly here.
Yeah, I'm excited to go on the tour with you. This is
fun. Have you ever been to a center that focuses on regenerative therapy?
I have, but I haven't been to your center yet.
There we go. How's that?
Okay. Good.
Okay. So you see down this hallway, there are 10 treatment rooms, and every single one of them, we built this from the ground up 16 years ago. Every single room was consciously created based on feng shui, like a true center that represents healing, not some sterile place like so many of the hospitals, right? That doesn't really welcome you as a person.
Right.
And so these are the beautiful rooms. We have this incredible ceiling mural.
Oh, wow.
It's called Heaven. All the major archangels, all those beautiful energies that are around us all the time that we don't know about. We don't know that they're there, but they're there. So it's powerful. That's a powerful, powerful vortex in this center. This is our room where we do a lot of our regenerative therapies, all the PRP, so the O shot for women for sexual rejuvenation, the P shot for men, the Priapus shot. We do facial rejuvenation, hair restoration, breast, and so many people to help them prevent having to have knee replacements, hip replacements. We do a lot of restorative medicine. This is our pharmacy.
You have some supplements in there.
Oh, we do. Lots of really great companies that I've worked with over my 30-year career. And we have an IV room. This is called the IV Center of Santa Fe. Yeah.
Cool.
And then we have a team of practitioners here. We have a kitchen. Like I said, all of it was based on feng shui. We have really incredible technology from Russia, Austria here called the AO scan. And my friend Harry Massey, we have his system here as well. This is actually our vision, like of Santa Fe Soul, all the 13 core values. And we actually really live this, where we honor the earth, we honor the sky, we honor a Mother Nature, and because that's who we are, right? We are more bioidentical to the earth than anything else. And often what's good for the earth is good for us. And we need to really think that way in terms of regenerative medicine, which is, again, that word regenerate means a fresh start, a new beginning. So many people, especially in this pandemic time, are exhausted. There's a lot of anxiety running inside them. There's a lot of fear. So we every day we just get to help people take back that control inside and know that you can turn again a degenerative condition into a regenerative one, where you're producing new healthy cells and tissues and blood vessels and all that. This is our prayer wall that represents all healing and spiritual traditions. And when we think of regenerative medicine, even though it's one of the fastest, it's a new category of medicine. It's drawing on ancient traditions. Acupuncture, Chinese medicine is regenerative. There are so many beautiful forms of medicine that we don't need to take drugs that really help the body from the inside out. And this just is our room, what we call the brain and body optimization studio. What
are those cool pod things back there?
Okay, that big thing back there is called a theta chamber in the corner to the left. Okay. And that has 7 different modalities. One is vestibular motion. And then there's sound and light, and there's PMF in there. And basically what it's doing is creating new neural pathways. Neuroplasticity is so important if you want to get rid of addictions. If we're kind of heading towards cognitive decline, we want to create new glial cells and new healthy, what's the word I want to use? We really want to get better circulation. We want to help get the inflammation out of our brain and other parts of our body. So it's an incredible reset. People have some epiphanies in there. They get great ideas.
major healings happen. And you can hear this little bubble thing is a hyperbaric oxygen chamber. And that's really good for traumatic brain injuries. A lot of our patients with advanced autoimmune conditions, even cancer, people who've been in accidents, who have non-healing fractures or any type of wound that's not really healing well. That's really incredible. But a lot of biohackers in Santa Fe want to come to get that edge in terms of getting your brain working better, your whole organ system, your hormones. And then we have over here in this corner, that's an infrared sauna.
Infrared sauna.
Infrared sauna that also has the best of Royal Raymond Rife, who was like one of the most brilliant people when it came to light and the power of light to heal on a cellular level. So in this situation, you actually have an open infrared sauna experience along with these really cool lights. And
wow,
it might be kind of fun. It's called the Photon Genius, just to show you what it's like. Isn't that cool?
Oh my gosh.
Those are neon gases, and frequency medicine is amazing. I mean, really, when you have healthy cells that have a healthy vibration, I recommend the book Healing is Voltage, where you can actually, when you have dis-ease, you have low voltage in your cells. And so with regenerative medicine, we want to help one go from, again, that degenerative situation that's going on in the body and get the cell you to work, get back to your original nature, to get your cells and your body and your brain working optimally again. So that's my little tour.
Wow, I love that. Thank you so much. Thank you so much. All right, so you just ran through a bunch of different modalities that you utilize. And this might sound redundant, but I just want to make sure I totally get it and that our audience totally gets it. So what do I heard you say that regenerative medicine includes, acupuncture and Chinese medicine and all these really amazing new cutting edge technologies. What else does it entail that we haven't talked about?
Regenerative medicine?
Mm-hmm.
It's like I've mentioned earlier, like stem cells, or how are we using our own stem cells to regenerate new healthy tissue? So very often, there are certain clinics where doctors will extract your stem cells from your fat, from your bone marrow, from your bone. And so that's probably, again, one of the most well-known sections of regenerative medicine. But it also is IV therapies. Like I mentioned, that the hyperbaric oxygen therapy is an oxidative medicine that really helps you on a cellular level. Acupuncture. There's so many different types of medicine out there that are more, again, about helping the body heal from the inside out and not adding toxicity to the body. That it's not just about treating the symptoms, it's getting to the root cause.
Okay. So what age do you think people should start thinking about healthy aging or regenerative anything?
Well, I think your 30s, a lot of times people don't really start thinking about it until you have an injury that's not healing very well, or you have brain fog, or you're getting hot flashes. Often we wait too long. But I think in this time that we're living, that people are realizing they have to be more proactive than ever, because we do live in a very toxic world. There's so much hormone dysregulation, the emotional body. Wow. So, like epic levels of stress. That's probably one of the key things that really affects us in terms of getting in the way of our natural ability to create a healthy body. And have a healthy immune system. One stressful event can cause like 1,400 reactions in the body that are really challenging for our nervous system, right? So it's just really important to be the best, your own CEO, like be your own healthcare advocate on a regular basis. It's like self-care is a way of life, not an event. Right. Yep. So, but I do get a lot of women in their 30s, but I'd say like the sweet spot where most women and men are really looking at this seriously is probably in their, their early 50s, but late 40s or mid 40s is a really good time, because if you start living what I call regenerative lifestyle, it makes all the difference in the world, because you can feel good every day when you wake up in the morning and have the energy that you want, and to have restorative rest. In terms of a regenerative lifestyle, I mean, one of the most important things is getting good quality sleep. And a lot of people are struggling with sleep across the globe. So that's something that I really help my patients to restore, like to have really good sleep, a sleep hygiene schedule, like turning off your lights at night, not being on your computer at least 2 hours before you go to bed. These things make a big difference. And if you just give yourself those 7 to 9 hours every night, it makes all the difference in the world in terms of turning on that powerhouse. Like, again, you don't really need to do a lot of external things, putting things into your body. You just need to allow your body to be operating at its best.
That makes a lot of sense. I know you mentioned that nutrition and, vitamins are part of, the protocol that you offer. So I'm curious, what are some of the natural kind of healthy lifestyle choices in addition to sleep and proper nutrition that people could be thinking about without even having to go to a clinic like yours, that are just easy to, they could start implementing today after they watch this show?
Well, I really have been sharing this for years, but truly so much of healing is for free. Because a lot of people think, oh, regenerative medicine is so expensive. It's true. Some cell treatments can cost $5,000, $10,000, $25,000, even more than that, right? But people who get outside, just getting out in Mother Nature, I mean, it's probably one of the best cures of all. And when you can, like being near the ocean, I mean, that is like really turns on your biology in such a beautiful way, because of the negative ions. Going barefoot, being really connected to the earth is really critical now more than ever. I mean, at least like 4 or 5, 10 hours a week, just getting out in nature, because that really calms the nervous system, turns off the beta. I mean, just the fight or flight, go, where, our nervous system, there's our sympathetic, which is our go, our masculine aspect. And then there's the parasympathetic, and that digest and rest is what many of us are really struggling with. And so there becomes this dystonia where the body gets confused, and it gets stuck in that go, and you can't sleep, and you can't digest, and you can't metabolize very well. And your body can't get rid of pathogens, because we are living in a very toxic world, and we're living indoors way too much. Okay, so that's one. I call that free healing. And then food.
Say it again. You call it free what?
I call it free healing.
Free healing. Yeah.
Free healing, just being out in Mother Nature. And it's really fun when you get together with community and friends and family members too, and just get away from your phone, get away from your car, and just be. We are human doings way more than human beings, but being, like, to get that divine alignment of who you are in truth. A lot happens when you're not living, with all these masks and all these, ways in which you're trying to put yourself out there in the world, and just to keep going, and just attuning is really a beautiful awakening and alchemy for all of us. Again, to turn a degenerative habit or a way of life, or into something that's really healthy and health promoting. So second thing, I really want to talk about, food is medicine and exercise is medicine. Actually, if people go to robynbenson.com, you can there's a free kind of booklet on these 5 main things that I'm talking about right now. But food is medicine is really key. Like, in terms of inflammatory foods, I just tell most of my patients, rather than, spending hundreds of dollars on tests, although that can be a really important avenue, and I do a lot of testing with my patients, but staying away from inflammatory foods. So, wheat, dairy, sugar, all the whites. When you shop, avoid the inner aisles, just shop the perimeters, get fresh, organic fruits and vegetables, grass-fed meats. Makes all the difference. We want to create a symphony in our bodies. I'll say that word symphony. We want resonance. We want our bodies to be in our cells, to be allowing all the goodness of life to get in them, and to detox what is not good. And just think about eating the colors of the rainbow when it comes to vegetables. I mean, it's really important to get those phytonutrients when we think about all the diseases of aging and how there's like an exponential increase in Alzheimer's and cognitive decline right now. Heart disease is off the charts, way more so now than before this pandemic. And the levels of cancer and all that. So food is one of the best restorative ways to get your body back to its original nature and get it humming, get it working really well for you. Exercise too. I mean, we have to look at our ancestors and how they live very close to the earth. So food that comes from Mother Nature is bioidentical and it's easy to assimilate is excellent. But exercise, and it's not about like going to the gym and working out an hour a day. I actually think as less is best. I'm a recovering marathon runner. Oh my God. I ran a ton of marathons. I'm so grateful. That was a really interesting journey in my life for like almost 20 years. But I've learned now that, I do like 8-minute 4 days a week. I'll just do a high intensity interval training. I'll just go out, run as fast as I can for 30 seconds, then rest for a minute and a half, and then do that 8 times. So that's really all you need. And if it's not running, you can fast walk. Swimming is a really great sport. But these are all super regenerative, and it's just part of, like you come into this life in a human form. It's not a question of, oh, I'm going to exercise. You just do exercise. It's like something you throughout your whole entire life. It's so necessary to regenerate, your ligaments and tendons in your body, and to get oxygen flowing throughout your whole system. We have to move our bodies. So Jess, when people come in, like a lot of people fly in from all over the country to do these regenerative therapies that I know we're going to talk about, but we like to get them prepared. So it's nice when I can look at someone's blood work first to see if there's inflammation, like their SUD rate, if they're highly sensitive C-reactive protein, look at those levels. I want to see where there's inflammation and see if there's anemia. I see that in a lot of women. I'd like to look at your hormone profile, like if you're coming in for sexual rejuvenation and the men have low testosterone, their PSA is off. They have, look at the whole spectrum of hormones, and women that have estrogen dominance or are estrogen deficient, or a lot of women just don't have enough testosterone. So I like to look at those markers and sometimes help somebody get into this regenerative cycle before they come. And or a lot of people just want to get started, and this is what I'm really such a huge advocate of, helping people take the next steps to like be super committed to themselves, because your results from any type of regenerative medicine are going to be so much better when you're already honoring this body temple that you have.
I love that. Just even the concept to give to people about making a commitment to yourself. So it's really, it might be coming from a place of you already have an age-related issue or, environmental related issue that you're dealing with. But just to, ground yourself in the idea of, hey, you, like you said, to honor your body and to commit to yourself and to make that your health and your wellness a priority is so important. Whether it is you're trying to recover from something, or you're trying to stay in front of issues, and or you're just trying to navigate through this toxic world that we all live in now. So I really love that idea. I want to dive into some of these modalities that you use. So can you tell us, I'll just start kind of at the top of the list. What's PRP? What is it good for, and who's a good candidate for PRP?
Okay. PRP stands for platelet-rich plasma. And what we do is we take your blood and we spin it in a FDA-approved centrifuge, and we get your platelet-rich plasma, which is about 10 cc's. I call it the golden elixir. It is just full of great nutrients and peptides and enzymes and yumminess and growth factors foremost. And when we inject those into the vagina, into the penis, the face, the breast tissue, or a joint that really needs some support, it helps to increase elastin and collagen, increases new healthy blood vessels. It also kind of activates latent stem cells. We all have stem cells in our body, but a lot of times when there's a lot of more of a degeneration going on, your body's not detoxifying very well. When you put this rich plasma into these areas, it's that word, a second chance. It gives this tissue a second chance, a new beginning. So, for example, I had a woman that could not have sex for 8 years. She had 3 children. And what I was able to identify is that she had a ropey, I personalized it and customized it for every man and woman, but she had some significant scar tissue intravaginally. And all I did was I went in, and it sounds like, oh my God, it's gonna be so painful. But I have to tell you, most people get through this without feeling anything but a little bit of pressure. That's
my next question was, does it hurt?
It hurt. Yeah. Yeah. And so you asked the age. I mean, the youngest I probably have done for a man is in his 20s. For something, a lot of 20% of all 20 men have erectile dysfunction.
Mm-hmm. It's a big problem right now.
Yeah. Like I was mentioning with this woman who couldn't have sex for 8 years, her scar tissue, but I see a lot of men with scar tissue too. They have this condition called Peyronie's. So I actually inject right into the scar. So it's like a burst of energy to help to break down that scar tissue. So this particular woman, within, a day of having this PRP procedure, she was able to have sex again. And typically, some people can, depending on your age, right? Depending on the health of your soft tissue, I could do one of these procedures once every 2 years, but it depends. Like, so some people, they get like 50% better and they're gung-ho and they want to go all the way to get 90% better or 100% better, and will come back within, 6 weeks. But most PRP sessions, the full length to get the optimal value, it's up to anywhere between 8 to 12 weeks. So if somebody doesn't feel the shift right away, like a man, when I do this priapus procedure, we also give them a penis pump, and we also do this sound wave therapy called the Gaines wave. And so just like building any muscle, right? It's like you got to keep working on it. So for men, we give them a pump, and we want them to use that at least 3 times a week after their PRP procedure. But platelet-rich plasma, what's really cool about it, I mean, there's almost never in the history of PRP, this is huge, then people are not going to be allergic to their own, their own body fluids, right? There's so low risk value. You're not cutting somebody open, right? You're using your own beautiful biology to help regenerate a part of your system. So it's just been remarkable to see how invaluable this has been and life-changing for people with autoimmune diseases. There's a lichen sclerosis that can affect both men and women, which is a condition. It's kind of like I want to call it, it's in the fungal department, but it can be riveting. I mean, like, it just eats away at your tissue. And so here comes, to the rescue, this PRP to kind of give it a new possibility, rather than, some women, it just eats up the clitoral area it just eats up. You don't even see the clitoris.
And what is that called?
It's called lichen sclerosis. That's the name of the condition.
Okay.
Right.
What causes it?
Very often there's there's a parasite, a fungal condition in the body that's been there for a long time. That's why when I treat women and men like this, we got to look at their gut biome, their vaginal biome, to clean it up. And there can be some very, very, very stubborn fungal patterns in the body that are really hard to get rid of. And as many people know in functional medicine, very often with fungus comes heavy metal. So we have to look at that profile as well. It's really important that people work with somebody who, specifically is going to listen to your history and to help kind of get to the core issue in the body. So the PRP is great. And if people want to go to PubMed, I mean, there's like literally thousands of clinical studies on the efficacy of this. And you can also stack stuff with it. So you can add exosomes, mesenchymal stem cells to the PRP. I am a huge user of ozone in medicine, which is...
Tell us about ozone.
Oh, I'll go into that. So I can add, when I'm doing the PRP, I can inject, and then I will take the syringe off, and then I'll add some ozone into that joint too. It's pretty friggin' awesome. Okay, so ozone, I know it's a gas, right? But in medicine, wow. The reason that it's not like all over the place is because it's not going to make big pharma a lot of money, right? But what we do is we have like 4 different modalities. We treat the blood under ultraviolet light. So we take a certain amount of your blood, and then we put it into a bag of solution. Then we add ozone. So you have really got to get somebody who knows exactly what they're doing to understand the gamma, the strength of the ozone. And then that blood goes through an ultraviolet blood treatment that has this turbulator that exposes a lot of your red blood to different light. There's A bulbs and C bulbs, so they're more specific to viruses, bacteria, parasites. And then that clean blood goes back into your body. And it's pretty remarkable for people with non-healing wounds, people that are really sick with, a lot of these advanced health issues, from heart issues, cancer, digestive problems, stubborn pathogenic influences that you can get rid of. So, and then we also have a machine from Germany. It's called the 10 Pass. We do that one as well. But probably the one that the ozone therapy that I'm doing every single day, again and again throughout my day, is something called Prolozone. So people come in and they have knee pain, tennis elbow, shoulder issues, pelvic floor problems, instability in the ligaments and tendons, knees, hips, toes, ankles. What I do is I put in a proliferative agent first. That in one of those substances that I put into that injection is something called Regenerative, which again has peptides and enzymes and proteins that I put into the joint first, followed by ozone. And I can't even tell you, in 20 years that I've been doing this therapy, I feel like I'm the Prolozone queen in this country, but it helps so many people not to have surgeries, shoulders, elbows, hips, or buy more time. People like that are working and they just can't, take off a couple months to go out their hip replacement. If they're bone against bone, because it's not so good. Like people who have that going on, it's not as, it's not as effective for sure. But what happens under ultrasound, you can actually see where if someone has a little bit of scar tissue, they have a slight tear in their shoulder or their hip, it helps to, you can see under ultrasound where it helps it get back to its original nature. So again, good for scar tissue, good for arthritic changes, helps to get the ligaments and tendons get that blood flow back. And when you inject the specific area, the ozone spreads. So when I inject, let's say like a medial collateral ligament, I get more than just where I'm injecting. I'm getting a nice big circle and it just spreads. Ozone is just incredible. It's like it oxygenates the tissue. It gives the tissue a second chance. It just brings back life to it. So ozone is extraordinary. We can also do like insufflations into the nose. Like it's allergy season here in Santa Fe right now, and people were just miserable with juniper. So we do an insufflation into the nose. You can drink ozonated water, which is great. I love doing dental ozone. So people come in, their infections are not healing, or they don't want to get a root canal. Ozone in dentistry is free and amazing. So, and it's an oxidative medicine. So we think about as we age, like that rusting process that goes with barnacles, and we get, all kinds of scar tissue and sludge in our body. It's just incredible what this does to act as an antioxidant. So when there's hydroxy radicals or these free radicals in the body, it helps those become water, become hydrogen peroxide to, help promote a healthy cardiovascular immune system. It's amazing.
That's awesome. Okay, so let's talk about IV therapies. I'm curious, what are they? Why are they so expensive? Where can you get them and what are they good for?
Lots of good questions. Okay, IV therapies, because I've been doing this in my practice for about 20 years. And again, as a doctor of oriented medicine, specializing in regenerative medicine, I kept thinking, what else can I offer my patients, that are really struggling, especially, the post-COVID long haulers, also people that are, traveling a lot and want to have a healthy immune system, or people who are given a third stage cancer diagnosis. One of the best things out there is high dose vitamin C drips. And so we do 25 grams, that's 25,000 grams of vitamin C that go IV. And people have to understand that our body does not produce vitamin C. We need to get it from our diet. But in high levels in the body, when there is a space occupying lesion, there is infection of some sort, it's really great to help get rid of it, to eradicate whatever that pathogen is. Probably our most common one that we do is the Myers cocktail.
Mm-hmm.
We do that in a push, or we do it in a drip. And you know what? The prices vary, from like $90 for Myers cocktail, anywhere up to like $200, depending on where you live. But what's wonderful about IV therapies is they go right into your body, right? It helps, it bypasses the digestive system. It gets into your system very, very quickly. And they're popular for a reason, because people get great results from them. We also do NAD IVs, which are a little bit more high end, but in the regenerative world of medicine, very much known for helping people that need help with addictions like alcohol recovery, opiate addictions, but also people that their brain is just not working, that there's a lot of inflammation in the brain, in the liver. Doing a series of 10 of these is quite remarkable, and to help people with their cravings, help people get their brain back. I mean, it's like going from the dead to the living. So some of the people we've seen that we've helped with NAD, and then we also get people that will just come in once a month to get their NAD IV, just to kind of keep that edge, because they're movers and shakers in the world, and or they want to live optimally. They want healthy cells, and it really works on a cellular level. To get rid of inflammation and to promote longevity.
What's in the Myers cocktail?
The Myers cocktail has at least our formula that we've worked with, and we do customize it, but it has 6 grams of vitamin C, sodium bicarbonate, because you can't just put vitamin C directly into the vein. It has B5 and B6, vitamin B5 and B6, which is fantastic for the adrenals, because a lot of people are exhausted. A lot of people, it's really one of the best ones for people with Epstein-Barr virus. We get a lot of people every week that are like exhausted all the time. So, and the ones that can afford, that's probably the least expensive one. It also has B12 and B complex. B complex is so good. So when you get a Myers cocktail, very often you feel like a flush in your face or in your throat or in your groin, because of the magnesium that's in it and the B complex. See, what else do we put in? Those are the main ingredients in a Myers cocktail, as opposed to a vitamin C drip, which has, like I said, 25 or 50 grams of C, and then we add some B complex to that and B12. And we also, try to work with somebody that's not into mass production and compromising the quality. Even the ones like the people that can get their IVs in home, they're very often not getting near the amount of vitamin C that they need for the problem that's existing in their body. But you want really good ingredients. Like we do not use corn-derived vitamin C. So ask those questions to make sure that the doctor that you're working in the clinic is using really high quality IV solutions.
Okay. Will you help us with these specific questions? Because, viewers and listeners are going to be getting this information all across the planet. And, you might have the ability to, get to Robyn's clinic in Santa Fe. But if you don't, Robyn, help us with what specific questions they need to ask if viewers or listeners are curious about, I'm going to go get an IV drip. I want to try to do this before I travel, or I'm not feeling well and I need some extra energy. What specific questions should they be asking to verify about those quality ingredients?
Well, one of the things I want to say, if you ever get an IV, like we just tell all of our patients, you want to be hydrated. The more hydrated you are, the better the whole experience is going to be, because not getting your vein is not fun. But you want to make sure that they're preservative free as much as possible, that they're not using corn in the vitamin C, that a beet derived version of vitamin C is way, way, way better. That there's different types of magnesium, that you just really want to know that they're putting their care in providing the best possible quality, because it's a crazy world out there in this whole regenerative field, in terms of if you go and they say that you're getting some type of a stem cell from, let's say, an umbilical cord. Well, that can be $5,000, or it can be $400. What is the difference? So ask those questions, especially if you're working with clinics that are doing exosomes and different IV therapies. Like, you just really want to know what's going in there.
Okay, that's helpful.
And also, you want to have good kidney function. Yeah, that's really important. And people with COPD, certain people that just their filtration system, their kidney system is not optimal. You want to make sure you're a good case. Like, every time somebody comes in, we get new patients every day that just come in for IVs, and me or one of the other doctors will go in, even if it's just for a few minutes, just to look at their health history, make sure that they're a good candidate for our IVs.
Okay. And help us understand who would be a good candidate for an IV?
Pretty much, we go as young as 10-year-olds that have, immune system dysfunction going on. Anybody that just feels like that their body is struggling a little bit. You look at everything, like from like this world in which we live in, and you're worried about getting on a plane and getting sick. So you want to be proactive. So a lot of people will come here and then head to the airport. Yeah, it happens all the time. So the people like that are very good candidates for this. And then if you're around young children all the time, or you're going to go see a relative and they're elderly, and you just want to practice extreme self-care for yourself and your loved one, that's another good reason. People, if you're diagnosed with any type of autoimmune condition, you have hair loss, you look in the mirror and you look 10 years older than you are, that's another, like, whoa, that's like a wake-up call. Something's listen deeply to your body, because sometimes things are silent, but very often our body gives us messages. Yeah. And yeah.
Okay. Well,
hydration,
earlier,
I didn't mention that hydration. Like, a lot of people come in for just hydration IVs. They just feel like they're not absorbing water very well. They're just looking at their skin and they look very dehydrated. Sometimes, or when you're sick or you've been vomiting and you just can't get your pep back in your stuff, just getting a lactated ringers or a hydration IV is fantastic. I also didn't mention this, but glutathione is our most important one of the most. We got to know about C60 too now, but glutathione is a really important antioxidant that we all produce in our bodies, but most people in this very toxic world are deficient in that. So very often when we do our vitamin C drips, we will follow it with a glutathione, or we'll start with a glutathione. Even with our NID IV therapies, we add it. Anybody who's had a lung condition, pneumonia, and just can't get their breathing is not back to normal. And there's any liver signs, fatty liver. A lot of people don't even know they have a fatty liver, but 25% of the world population does. And that's like a silent little bomb going off the body, because the liver has 500, 600 different functions. And when you have a fatty liver, it just compromises your ability to digest, to filter the blood. It also processes our hormones. So a lot of times we have hormone dysregulation because of an overactive, a stagnant, we call it in Chinese medicine, liver qi stagnation. People are wired and tired, and the liver is compromised. So a lot of what we do in regenerative medicine is we want to get that liver working really well. We want to restore healthy NAD levels in your body.
There is so much there. Um, this is so good. All right. So what are some of the signs that you might have a fatty liver?
Fatigue. The number one is just like chronic fatigue. And I think they might have Epstein-Barr virus, or, there's so many viruses and fungal and parasitic infections, but that's one, because even a blood test very often won't show it. A lot of people with fatty liver have hypochondriac, like below the chondria, below your rib cage on the right side, have like, just, it feels like inflamed there. But pretty much the only way to absolutely determine if you have it is to get an ultrasound done. I just feel like that should be like, seeing your doctor once a year, or getting a colonoscopy every 5 years. It would be really helpful if everybody, every 2 years got a ultrasound to their liver. I just want to be totally transparent. About 3 years ago, I brought in a guy from New York that does full body ultrasounds, and so he said he just gifted me a session. But it wasn't showed up fatty liver. I can't tell you how many, Jess, we're in a circle of health entrepreneurs, of my friends have fatty livers, right? And we are super healthy.
Yeah.
Like, I've never missed a day of work in 30 years because of being sick. But what he said, he's like, I see this a lot in practitioners that take too many supplements, like taking too much of the good thing, or you're running a lot of stress in your body, and or it's just a genetic predisposition that you just don't like. One thing that I knew before this is I don't break down fats very well. Like, if I have an avocado or two, I feel horrible. Right. My body just doesn't process it. So I was able to reverse it. Talk about a regenerative journey I went on. I've been on a lot, but I totally reversed that. I don't have starch.
How did you do that?
So I did that by actually doing certain supplements, like that are aimed at like beta TCP from Biotics, something called lipotropic that will help. So when I do have fats, that I take an enzyme to help me break it down. Okay. That was really important. I did some of the regenerative therapies, exercising with oxygen. I did PMF, pulse electromagnetic field technology, where I would put that right on my liver and gallbladder. That was very, very helpful. I did a parasite cleanse, which I thought was really, really good. I'm not much of a sugar person, but I cleaned up my all of the good sugars in my diet. It was amazing. It probably only took me 3 months to do it, but it was a really good journey. But the one thing I did know, I had a little bit of fatigue, but I really, more than anything, I'm just like, if I just felt kind of congested. And anytime I had fat, like I said, I only had good fat. I would it would just hang out there, because there was fat in my liver, and it was even making it more difficult for me to break down the foods that I was eating, especially the fats. But I also was very proactive with my family, because our dad died of he had liver pancreatic cancer. So my siblings, my brother has a fatty liver also. So it was a really good thing, because that can turn into liver cancer, right? It cirrhosis of the liver, when you're not getting that full detox capabilities of your liver are compromised.
Yeah. Wow. Well, good. Like, I'm so grateful that you were able to, get the scan and get that feedback, and be able to, take action about it immediately, and turn it around in a short amount of time. That's a really impressive story. And probably a great, learning experience, not only for yourself, but for your family, to witness you going through that process.
Totally. And it was like the last thing from my mind, but I think I had it for a long time. I had definitely been a supplement queen. Yeah. And one of the things that I love about C60 is that it helps us not to have to take so many different things, right? That your body absorbs it so well.
Yeah. Well, you mentioned some at-home remedies that people can do for regenerative medicine. And I was wondering, you mentioned a red light and PMF. Can you talk to us a little bit about kind of what those modalities or technologies are and where we might be able to find them and what we could expect from them?
Yeah. Well, in our home is our total self-care, like that. It becomes like a sanctuary of taking care of yourself. So in your kitchen, you want to cook yourself really healthy meals. That's regenerative. Hydration is essential. A lot of us are dehydrated. They eating a high water content diet is really important. Your bathtub is so great, right? You can put in Epsom salts, or when I have patients that are doing parasite cleanses, it's really good to like do a half a cup of hydrogen peroxide and a half a cup of baking soda and add that to your bath. I mean, that it's amazing through your pores, like as hot as possible. That's really restorative. Having blackout shades in your bedroom, because that sleep and not having any light is so essential, because our melatonin productions get compromised a lot when there's too much light. Whether it's your TV or it's all the electrical appliances all over the place, right? Sometimes I've gone into my patients' homes or my family. I'm like, holy, how do you even sleep in this? I was like, there's so much of these electromagnetic fields that are just so toxic and affect the body's ability to get all the goodness of life and to detox. PMF is wonderful. There's a lot of red light therapy modalities out there that you can get that for your face to restore healthy tissue, collagen, elastin, cupping. Oh my God, there's like, essential oils, right? Like if having lavender oil and thieves, I love clove oil, having a distillation to really get that in your air and to breathe that in would be really good. Having an air purifier is fantastic. We have, I think it's called the Air Doctor. If you live in a dry climate like I do, we have a really good humidifier, right? But you got to do the work and keep those really freaking clean, because they can promote mold very easily. But yeah, you're just doing everything you can to have a beautiful, healthy home environment. Matters. Clean out your pantry, get rid of all the expired food. Like my mom, oh my God, never forget going into her refrigerator one time in Florida. I'm like, oh Lord. I mean, like I had to take like half of it out because there were just expired products in there. And it just like, that is like one of the worst things you can ever put it in your body, is something that's a food that's been expired, that has, literally full of crapola in it. You just don't want that. So yeah, just think about that. Like a regenerative lifestyle is something that it's in your bedroom, it's in your bathroom, all these ways that you're putting out this high vibration of a lifestyle that you're choosing to live. And that makes all the difference in the world, because by the time we get a diagnosis of, let's say, cancer, it's in your body for 10 years, right? So we can write these whole new stories. My women's retreat, like a whole new story for your vagina, for your face, for the dream life that you want to be living here now, not like seeing it out there in the future. Right. What are you doing to align, in where you're living this truth of who you are? You're living this vibration of your passion, of your, whatever it is that is your true north, that you get to live that. But having a healthy body is everything. And again, it's like the Lazarus effect. The women who come to my women's retreat, or people who are just somewhere in between, they're just like, oh my God, I don't know what's wrong. I just don't feel like myself. I don't wake up in the morning with the energy I used to have. Something's not right. And if that's what we're here to do, is to help you, live by design, not by default. Like design this lifestyle and to design this aging process, which we all age, but it can be done so beautifully. And it can be done with like literally like people in their 60s having better energy than they had in their 30s when they start doing that chemical cathartic process of identifying what's eroding, what's causing fatigue, what's causing disruption in the neurobiology. So that's what it is. But it starts in the home, and it starts with your really care for yourself. A lot of people it's just you got to put yourself first, your oxygen on your body first, right? You got to put yourself first to show up in the world in the way that you want to, and your family and friends, and for yourself foremost, because you live with you. You live with you.
I love it. I love it. It's so good. And I know both women and men come to your clinic. I'm curious, you mentioned earlier about, some of the issues that you're seeing from, ED with even young men in their 20s and women who've got, scar tissue or injuries that have, as a result of either trauma or pregnancy or childbirth. But I'm curious, outside of those, what are some of the most common issues people as they age are suffering from with regard to their sexual health and wellness?
A lot of times, incontinence is a thing for women, right? Where that plays in that whole role of the whole urogenital area is really important. So if your urinary system's not working, that can get in the way. But a lot of women, as they approach perimenopause, menopause, have dryness, scar tissue, anorgasmic, don't have a vaginal orgasm. Only 20% of women have vaginal orgasms. There's just there's a story within a lot of women. A lot of sexual abuse has happened, and that the whole area gets kind of shut down. Just energetically, sometimes I could just touch a woman's stomach and you could just tell that there's not much life force there. So PRP in this area is really great, but also identifying hormonal imbalances like the estrogen, testosterone, progesterone, oxytocin, looking at thyroid hormone, really important. So you want to look at all of that, but it is an area that, why do most women end up in a nursing home? It has to do with the prolapse of the organs and also lack of bladder control. And when you start working that when you're 40s or 50s, and the health of your overall pelvic floor, I actually just did a webinar for my podcast group, and just focusing on that, because as we age, it tends to drop, right? It tends to, there's a lot of incredible ligaments in the pudendal nerve, and it's a whole important biosystem. So to lift what's wanting to naturally come down, learning to do Kegel exercises are really important for the pelvic floor. So these are things like, in addition to getting the PRP, what can you do to keep restoring, regenerating, renewing healthy tissue in that area? So it's a game changer for so many women and men. I mean, men can expect a little change in girth. It can also, like, more pleasure. Like, well, who doesn't want more pleasure, right?
Right.
And so as men, approach their 50s and 60s, and women too, they just don't have the same kind of pleasure that they had, let's say, in their 20s and 30s. And what I love, helping both men and women to have their best sex, their best sexual experience, their best pleasure, to move energy in their body and to literally just feel lit from the inside out. It's possible. But it's really having a better relationship with your sexual organs and to touch yourself. And I do recommend masturbation too. But I'm not a big fan of porn, because I think I see too many people come in and they have porn addiction, and it makes it really difficult. And this is this is why so many young people have sexual issues, because they've learned from porn, and that just like shuts down the neuroplasticity. It just completely disorients them from their own body. It's really so sad, but that can be regenerated too, but someone's got to go the distance, like really be so radically committed to yourself, like your life depended on it. That's how important it is when people are in a difficult spot with their health.
Yeah. Well, I love this idea that you could, in your 60s or 70s or beyond, be having the most amazing sex of your life. That's a really cool concept, and, an aspirational goal that we could all look forward to. So I really appreciate you educating us today, Robyn, on all things regenerative medicine. Really appreciate the work that you're doing, helping people take back control over their health. It's really exciting.
And I love with men and women, like they don't even know, like there's like 9 different anatomy types of a men's penis. And there's, especially for the women, right? Because labiaplasty is a form of plastic surgery where women are being cut because they don't know how they look down there. So this is why I'm so passionate about doing this work, is to help women kind of reclaim their sexuality, their pleasure zones, to love their yoni, their pussy. Oh my God, I had the most amazing conversation with the woman, Regina Thomas Howard, who wrote the book Pussy, for my podcast. But it was like, wow. I mean, like, in my women's retreats, like women leave and go through this whole transformative process of like, wow, like to awaken to that sovereign person, man or woman, that you are. But it's so I see so many desperate men, when they lose their sexuality. I mean, it could be, God, the isolation, the fear, it's so sad to see the prison that people are in, and that doesn't have to be you.
Yeah. Well, this is really exciting stuff. So let's tell the audience, if you wouldn't mind, best ways to get in touch with you, to follow you, to download your content, to get in touch. We'll pop up all these links here as you're speaking, and we'll also put them in our show notes.
Okay. So you can just go to podcast and just download my podcast called Younger. Also, my center is called Santa Fe Soul. That's SOUL, santafesoul.com. And then all my regenerative medicine and a lot of just free stuff that I shared to understand like what the top 5 regenerative therapies are. You can just go to robynbenson.com and destinationregenerate.com. It's like, so a man that wants to come and just do an art, we call it art, which is Amplify, Regenerate, Transform, which is a VIP day where I just work with you individually, just like to co-create a beautiful journey to receive some of these therapies and to personalize it and customize it just for you.
Awesome. Are you on social media too?
I am. If you just Google, I guess just robynbenson.com. I'm on social media. I'm not, I might have some of the, maybe in the show notes, you'll have some of the links that I think I might have shared with you. Yeah.
Okay, great.
Thank you, Jess. This was such a blessing to have this time with you and the audience here. And we just welcome you. Our doors are open for you if you ever want to come to Santa Fe and do a deeper dive into what's possible.
I'll be there soon. This is so exciting. Any parting words of wisdom for our audience before we say goodbye about just thoughts around the opportunity that we all have to regenerate a new healthy body at any age naturally?
Yeah, there's this anonymous saying that I love so much, but in the end, what matters most, how well did you live? How well did you love? How well did you matter? And how well did you learn to let things go?
Oh, that's a great reminder. Thank you so much. That's beautiful. Robyn, we greatly appreciate you and all the work that you're doing. Thank you so much for your time today.
Thank you, Jess. It's been wonderful.